In this class, we are going to see on the details of brachial plexus. The plexus which is seen in the upper limb region and it is the major nerve supply for upper limb part. The name brachial plexus, it indicates brachium in the sense arm region, and plexus means plate-like appearance. So this brachial plexus, it is originating from neck region or the cervical region. Then after, it is going to descend downwards to supply the whole of upper limb part with its branches. So brachial plexus, it is a very important topic for your exam purpose, and it is also very simple and easy to remember. So going into the details of brachial plexus, here in this image we have removed pectoralis major muscle, minor muscle, and then we have removed clavicle also, and some superficial nerves also got removed. Now we can view the brachial plexus origination by removing some other structures, such as we are going to remove deltoid muscle. So first we will remove deltoid muscle. Now you can make out the bones clearly, and then we can remove the axillary vein. So here we have axillary vein and also axillary artery is removed. So axillary artery will be removed. Okay. So if we remove these structures, then it will be easy for us to remember or easy for us to see the image of brachial plexus clearly. Okay, so now we are going to the details of brachial plexus. So brachial plexus origin, it is taking from the spinal cord. So you can make out clearly in this image, we have removed all the branches of axillary artery, subclavian artery, and also the tributaries of axillary vein, lymphatic vessels, lymph nodes, etc. from the neck region, and also from the part of axilla region to view the brachial plexus clearly. So in this image, that is in the posterior view, you can see three roots arising from the spinal cord. So those three roots are, we can make out here, that is, we will be having upper trunk of brachial plexus. So this trunk is called as upper trunk of brachial plexus. Then we will be having middle trunk of brachial plexus and the lower trunk of brachial plexus. So these are the three trunks of brachial plexus. But we have root here which we can't see clearly. Those roots will be 5 in number. It is formed by C5, C6, C7, C8 and T1 nerve. So these spinal nerves are contributing for the formation of brachial plexus, and this you have to remember ventral rami of lower fourth cervical nerve and first thoracic nerve are contributing for the formation of brachial plexus, that is C7, C5, C6, C7, C8 and T1. So these things are going to form trunk again. So brachial plexus, we are dividing into 4 regions. One is originating part, that is root. Then we have trunk. Again trunk is going to give some division, and from that division we will be getting cords. That cords again, it is going to give some branches. So now we will see about trunk, how it is formed. Trunk will be formed by upper, and we'll be having C5 and C6 root joined together to form the upper trunk. So this is C5, this will be C6. So what you're seeing here is C5, and the below one we will call as C6, which is going to form superior trunk or upper trunk of brachial plexus. Then we have C7, which is going to form middle trunk. So we have C5 and C6 forming upper trunk, C7 alone forming the middle trunk, and then here we have inferior trunk formed by C8 spinal nerve along with T1 spinal nerve. So this is inferior trunk. Now we have divisions formed by these trunks that we can make out clearly. So if you are seeing here, see in this image, in anterior view we can see somewhat. Okay, so it may not be so clear, but you can make out here. So this is upper trunk, right? So this upper trunk again got divided into 2 branches, such as 2 divisions. anterior division. So here divisions are not that clear. So in this image we will try to see. So see here we have anterior upper trunk with anterior division and a posterior division. This division is called as anterior division, this is posterior division, and middle trunk again will divide into anterior division, and here we will be having anterior division and below we will be having posterior division. Same way this is lower trunk, again we will be having posterior division and an anterior division. So these are the divisions happening in the each trunk of brachial plexus. So we have 5 roots. Each of the 5 roots is going to form trunks, that is 3 in number. One is upper trunk, another one is middle trunk, and then we will be having inferior trunk. The upper trunk again will get divides into anterior division and posterior division. Same way for in the case of other 2 trunks also. Now these divisions is going to join together to form cords. That is, we will be having anterior division of upper trunk and the middle trunk joined together to form the lateral cord. So we have anterior division of upper trunk and the middle trunk going to form lateral cord of brachial plexus, which you are seeing here. Then we will be having again lower trunk's anterior division. It is going to form again medial cord of brachial plexus. So this will be medial cord of brachial plexus, which is formed by anterior division of anterior division of lower trunk. So we have remaining all posterior divisions of upper, middle and lower trunk, and that is going to form posterior cord. So altogether we have 3 cords. One is lateral cord formed by anterior division of upper and middle trunk, and then we will be having medial cord formed by anterior division of lower trunk, and then we will be having posterior division of again upper, middle and lower trunk going to form posterior cord of brachial plexus. And these cords are going to give many branches, such as again divided into many branches. Lateral cord will give 3 branch and remaining 2, that is medial cord and posterior cord, will give 5 branches each. About the details of these branches we will deal detailedly in our next session. Now you just orient yourself how the brachial plexus will be arising from the spinal cord and then traversing the neck region, and how it is reaching the axilla, and how at last how it is terminating by giving its branches. That's all about brachial plexus you have to remember, and the simple way of reading this I will teach you. Just orient with this diagram, and now we will go on to the details of brachial plexus. Now we are going to see the detailed description about brachial plexus. So before moving on to this topic, we will see under what topics we are going to cover this brachial plexus. So we are going to see its definition and where it is present, situation, and then we will be seeing parts, formation and branches along with its applied aspect. So now we will move on to definition of this particular plexus. Now plexus usually it means it have an appearance like braid. So in Latin we will call plexus as braid, or else you can name it as plate-like appearance. So plate-like appearance, if you are seeing, that is called as plexus in our human body. So it is again divided into nerve plexus, venous plexus and capillary plexus. So we will be having this type of plexus formation in nerves, veins and capillaries. About nerve plexus to talk, it is nothing but an interlacing communication of spinal nerves. From spinal cord we will be having spinal nerves arising. Those spinal nerves at some region it is going to form plate-like appearance by joining or interlacing with other spinal nerves. That type of appearance we will call as plexus. So this nerve plexus in our body in 3 in number. So those are brachial plexus, cervical plexus and lumbar plexus. That's all about the definition of this particular plexus this thing. Now we will go on to brachial plexus introductory part. Now plexus which is going to supply whole of the upper limb, we will call that as brachial plexus. As I indicated before, brachium in the sense it is intimating arm region. So this now plexus which is going to supply whole of the upper limb we are going to call as brachial plexus, and it is formed by lower 4 cervical spinal nerve along with first thoracic nerve. So these are the 5 spinal nerves which is going to contribute for the formation of brachial plexus, that is C5, C6, C7 and C8 spinal nerve along with T1 spinal nerve. So these 5 nerves are important nerves which is going to give a plexus formation to supply the upper limb region, and this again will be having some branches. So those branches arising from these plexus are mostly of mixed type, that is it will be having both motor and sensory fibers in it, and then these fibers are derived not only from one nerve root, it is derived from more than one spinal nerve. So as I said before, we have 5 spinal nerves contributing for this brachial plexus. So if you take about one branch, that branch will be carrying 2 to 3 nerve fibers from the origin. So you can't name one branch with one nerve root. It will be carrying 2 nerves fibers along with it. So it will be having mixed type of nature. It will be having both motor and sensory fibers present in its particular nerve. Now we will move on to location. So talking about brachial plexus, where it is present, it is taking origin from the cervical area, that is from the neck region. So in neck region you will be having a region called posterior triangle. From the neck region, from spinal cord of neck region, these nerves are getting arised, that is from cervical segment and also from thoracic segment. Then after it is going to form a plexus and reaching the posterior triangle of neck. Situation, first thing you have to remember, it is originating from the cervical region, and in cervical region we have cervical segment of spinal cord. There we will be having cervical nerves such as C5 to C8 along with one thoracic segments of spinal cord giving thoracic spinal nerve. So these 5 spinal nerves getting originated from neck region. So after coming from the neck region, it is going to reach the posterior triangle of neck. So once it reaches the posterior triangle of neck, as you are seeing in this image, so we have posterior triangle present here. About these triangles we will study detailing in head and neck part. Now you just remember it is reaching the posterior triangle. So once it reaches the posterior triangle, this again descend downwards and then it is going to reach the axilla region. You can remember that this is neck region, and from neck region we will be having a communication. That part is called apex of axilla, which we otherwise known as cervico-axillary canal. So through that cervico-axillary canal, this brachial plexus are going to enter. So brachial plexus, first it is originating from the neck region, reaching the posterior triangle of neck. Later it is descending downwards to reach the axilla part. While reaching the axilla part, it is going to pass through cervico-axillary canal. That's all about situation. Same thing here. The plexus, it is situated in the posterior triangle, and another important thing you have to remember is posterior triangle will be having floor muscles such as scalene muscles. So these nerve plexus will be related close to this scalene muscles, and after coming out it is going to reach the cervico-axillary canal. Then after it is reaching the axilla. That's all about location. Now we will move on to parts of the brachial plexus. Talking about parts of the brachial plexus, again we are dividing this brachial plexus into 5 parts. From origination till the termination, we are dividing the brachial plexus into 5 parts such as roots, trunks, division and cords along with its branches. So these are the 5 parts of brachial plexus which you will see, and then about the details of brachial plexus we will deal now. Just to remember, the parts of brachial plexus are 5 in number. Starting from the cervical region till the axilla, it is divided as roots, and then we'll be having trunk, These trunks again divide into two divisions such as anterior and posterior division. Later we will be having cords coming from these divisions, and these cords again it is going to give some branches. At last it is terminating by giving these branches, and these branches are going to supply the muscles of arm and forearm region along with hand. That's all about brachial plexus parts. Now we will move on to each part separately. Talking about the roots of brachial plexus. So the root of brachial plexus is taking from, we have 5 spinal nerves contributing for this brachial plexus, such as C5, C6, C7, C8 and T1 spinal nerve, and all these will be having 2 rami such as ventral and dorsal rami, or else we can call as anterior and posterior rami. Here for brachial plexus formation, we will be having anterior primary rami of all these 5 spinal nerves contributing for the brachial plexus, which is a very important point you have to remember. From which rami these brachial plexus are originating, they may ask. So it is taking origin from ventral rami of C5, C6, C7, C8 and T1 spinal nerve. So we have ventral and dorsal rami coming from spinal cord. Among that, ventral rami is the one which is going to contribute for brachial plexus. Then we will be having prefixed plexus and postfixed plexus. What is the difference between these two plexus? Usually we will be having 5 spinal nerves which are contributing for brachial plexus. But in case of prefixed plexus, we will be having C5 to T1 spinal nerve contributing, right? In normal condition. In this condition, C4 will be contributing, where T1 will be having a small contribution. Usually, T1 will be normally having most of its contribution given to brachial plexus. But in case of prefixed plexus, it will be having contribution from C4 rather than T1. In case of postfixed, what will happen? It will be having contribution coming from T2, from the lower level, and not from the C5. So this is the difference between these two plexus, that is prefixed plexus and postfixed plexus. Prefixed in the sense contribution is made by C4 than T1, and in postfixed plexus contribution is made more by T2 than C5. So same thing you can make out. The plexus is shifted one segment above, that is the contribution from C4 is great and T1 is reduced or sometimes absent. So in that condition we will call this brachial plexus as prefixed plexus. In case of postfixed plexus, the plexus is shifted one segment below, that is the contribution from T2 is great and C5 is reduced or sometimes it will be absent. So this is the difference between prefixed and postfixed plexus. So I think roots is clear for you. For roots you have to remember we have 5 roots arising. So from C5 to T1, and all these are ventral rami of spinal nerves. So now we will move on to our next part, that is trunk. So we have 5 roots, right? So these 5 roots again going to form trunk. How it is going to form trunk? So we have 5 roots and 3 trunks. So now we will see trunks. We have upper trunk, middle trunk, and then we will be having lower trunk. The upper trunk is formed by union of C5 and C6. So we have C5 and C6 spinal nerve together going to form upper trunk. And the middle trunk is formed by only by C7 spinal nerve. Coming to lower trunk, it is formed by C8 and also by T1. So C5 and C6 together forming upper trunk, C7 going to form middle trunk, C8 and T1 going to form lower trunk. So these all about the trunk of brachial plexus, which is coming from the root. We have 5 roots and 3 trunks. You remember all these things? I will show you in a simple diagram which is easy for you to remember. Now you understand how it is related and how it is oriented. Now we will go to next part, that is division. So we have how many trunks? Yeah, that is three trunks. So these three trunks, it is going to divide again, and those divisions are such as anterior and posterior division. Each trunk, that is upper, middle and lower trunk, are again going to divide as anterior and posterior division. Here you have to remember, it should not be confused with anterior and posterior rami. That is different. Okay, that is coming from the root of spinal nerve. While forming the root only, you will divide into anterior and posterior while coming from the spinal segment. Here we are talking about anterior and posterior division from the trunk part. Okay, so after descending we have trunk part. That trunk part again dividing into anterior and posterior division. Here in this picture it is very clear. So here we will be having roots, 5 roots you can make out, and these 5 roots are going to form 3 trunks, such as upper trunk formed by C5 and C6, middle trunk formed by C7, and the lower trunk formed by C8 and T1. Now we have anterior and posterior division formed by these trunks. So all these 3 trunks are divided into 3 division: anterior and posterior of middle trunk, anterior and posterior of lower trunk. In such a way it is divided. Now we will move on to chords of the brachial plexus. Talking about chords of brachial plexus, in this picture again you can make out. We will be having these divisions, right? These divisions uniting together with random, and again it is going to form a single trunk. That single trunk we will call as chord. So how it is formed? Chords are again 3 in number. So those chords are, we will be having lateral chord, medial chord and posterior chord. Lateral chord is formed by union of anterior division of upper trunk and middle trunk. So as I said before, we will be having 2 division formed by all these trunks. So those 2 divisions of upper trunk, middle trunk and lower trunk, it is uniting with each other to form these 3 chords. So first one is about lateral chord. Lateral chord, it is formed by union of anterior division of upper trunk and middle trunk. So in this picture you can make clear, this is lateral chord, and this lateral chord is formed by union of anterior division of upper trunk and the anterior division of middle trunk. You can make out here. So anterior division of upper trunk and anterior division of middle trunk going to form lateral chord, and it is going to carry these 3 fibers, that is C5, C6 and C7 fibers. Now we are going to see about medial chord. So this medial chord, again it is formed by only the anterior division of lower trunk. So in this picture here, in the lower part, so this is again anterior division of lower trunk. So this anterior division alone going to form medial chord of brachial plexus, and so it is having 2 spinal nerve, that is C8 and T1 spinal fibers. So about lateral and medial chord you people may be clear. Now we will move on to posterior chord. This posterior chord, it is formed by 3 trunks, that is all the 3 upper trunk will be having posterior division. So posterior division of all the 3 trunks going to form posterior chord. So it will be carrying all the 5 spinal nerves, such as starting from C5 to T1. So C5, C6, C7, C8 and T1 spinal nerves and their fibers will be carried on to the posterior chord, and then we will be calling the chords by its medial, lateral and posterior chord because of its placement related to axillary artery. Axillary artery topic we already dealt in that. In relations you have seen, especially in the second part of axillary artery, how these nerve chords are located. So one is located posteriorly, another one medially and then laterally. So according to the position of the chords related to axillary artery, we are giving the name as medial chord, lateral chord and posterior chord. Now we will move on to this image of brachial plexus. So this image is clear to you, I think. Here you can make out the roots that are 5 in number starting from C5 to T1, and here you can see C4 spinal nerve and T2 spinal nerve, and this if it is contributing we will call as prefixed, and this if it is contributing we will call this postfixed. type of brachial plexus. And from here we are having trunks, and these trunks again we are dividing into superior, middle and inferior trunk. This superior trunk is formed by contribution from C5 and C6, middle trunk by C7 alone, and inferior trunk formed by C8 and T1. And then again these trunks are dividing into anterior and posterior division, that you can make out here clearly. So this is superior trunk which is dividing into anterior division and posterior division. Same way middle trunk into anterior above and posterior behind, and inferior trunk again we have anterior division and posterior division. So in this way divisions are made. Now what will happen to these divisions? These divisions randomly will get unite together, and then it is going to form cords. So we have lateral cord, posterior cord and medial cord. Lateral cord is formed by anterior division of superior trunk and middle trunk. You can make out clearly. So this is superior trunk's anterior division, and this is superior anterior division of middle trunk. So these two unite together to form a cord called lateral cord. And then we have again inferior trunk. Inferior trunk's anterior cord, it is going to form medial cord. So inferior trunk anterior division, it is going to form medial cord. The remaining posterior division of all the three cords such as superior, middle and inferior are all together going to form a cord called posterior cord. Such like you have three cords such as lateral, posterior and medial cord. And again these cords are going to give some branches. Those branches we will deal clearly later. Now you just remember, from lateral cord we will be having 3 branches, and from medial and posterior cord we will be getting 5 branches. Names of those are lateral cord, it is giving lateral pectoral nerve, musculocutaneous nerve, and then we will be having lateral root of median nerve. So 3 branches will be given by lateral cord. Talking about medial cord, we will be having 5 branches. You remember with a mnemonic 4M and 1 nu. So 4 M's. First M is for medial pectoral nerve, and second M is for medial cutaneous nerve of arm, and third M is for medial cutaneous nerve of forearm, and then we will be having another M for medial root of median nerve, and then we will be having U for ulnar nerve. So these are the branches coming from medial cord. Now we will go for posterior cord branches. So posterior cord, again 5 branches. Those are, one is for upper subscapular nerve and another one is for lower subscapular nerve. Then we will be having axillary nerve and radial nerve. So here you have to remember like ultra. So upper subscapular, lower subscapular along with nerve to latissimus dorsi, that is thoracodorsal nerve, otherwise known as thoracodorsal or nerve to latissimus dorsi. These are the 3 branches coming from posterior cord. First, so those are upper subscapular, lower subscapular and nerve to latissimus dorsi, otherwise known as thoracodorsal nerve. Then ULT got over. Now we remaining as R and A. So that is nothing but radial nerve and axillary nerve. So altogether we have 13 branches coming from brachial plexus. So we have 5 roots, 3 trunks and 2 divisions from each trunk, and then we will be having 3 cords, that is lateral, medial and posterior cord, and together all these cords are going to give branches which are 13 in number. So these are the things you have to remember. We will see with a simple schematic diagram for better understanding of this brachial plexus. Now we are going to see a schematic representation of brachial plexus, which is easy to remember and it is very useful for your exam purpose to draw a simple line diagram. So brachial plexus from starting and how it is terminating we are going to see. As you all know, it is going to originate by 5 roots of spinal nerves, that is from lower 4 cervical and 1 thoracic. So these are the 5 spinal nerves giving origin for brachial plexus. So we are calling these as roots. These are C5, C6, C7, C8 and T1. I will show you the parts again later. Then after, these roots are going to form trunks. So how it is going to form? The upper trunk is formed by C5 and C6 roots. So this is forming the upper trunk. So this is the upper trunk formed by C5 and C6. Then after we have C7 spinal nerve that is going to form middle trunk. So we have middle trunk formed by single spinal nerve, that is C7. Then we have C8 and T1 spinal nerve which is uniting together, and then it is going to form another trunk called lower trunk. So lower trunk is formed by union of C8 and T1. So these are the three trunks you will make out: upper trunk, middle trunk and lower trunk. So we have 5 roots and 3 trunks. 5 roots are C5, C6, C7, C8 and T1, and then C5, C6 joining together to form upper trunk, C7 it is going to form middle trunk, C8 and T1 going to form lower trunk. Then what will happen to these trunks are, it is again going to divide into 2 divisions. One is anterior division and another one is posterior division. So these are the 2 divisions coming from trunks of brachial plexus. So we have again anterior division and posterior division of middle trunk. Same way in the lower trunk also we will be having anterior and posterior division. So in such a way we have anterior division, posterior division seen in all the 3 trunks. Now again these divisions are joining together to form cords of brachial plexus. So we have again roots. So till here we will call as root, then till this part we will call as trunks, and these trunks we can name as upper trunk, middle trunk and lower trunk. So in this way we got 3 trunks, 5 roots, and again each trunks are dividing into 2. One will be anterior division, another one will be posterior division. So same way in case of middle trunk also, and then we have lower trunk also, anterior and posterior division. So these are called as divisions. Now we have to see cords, how it is going to form. So to know about cords, again the anterior division of upper trunk and the anterior division of middle trunk are going to unite together. So anterior division of middle and upper trunk together it is going to join, and it is going to form a cord called lateral cord. So the cord what you are seeing here is lateral cord. So we have 3 cords coming from brachial plexus. One is lateral, another one is medial, and then we have posterior cord. So now we see in lateral cord, it is coming from anterior division of upper trunk and anterior division of middle trunk. Then we have again one anterior division remaining, that is anterior division of lower trunk. So this anterior division of lower trunk, it itself going to form a cord called medial cord. So this cord we will call as medial cord. So you got 2 cords such as lateral and medial cord. Now we have all posterior divisions remaining from all the trunks. So we are going to unite all these posterior divisions. So all these posterior divisions together it is going to join, and then it is going to form another cord which is called posterior cord. So we have another cord coming, that cord we will call as posterior cord. And that's all about the brachial plexus, roots, trunks, divisions and cords. So you might be clear, we have 5 roots and trunks 3 in number, divisions again 2 in each, and then we have cords together formed by anterior and posterior division of each trunk, and that is again 3 in number. So these are the cords. So we have these 4 divisions or these 4 parts of brachial plexus. Now how it is going to terminate? It is terminate by means of getting or giving some branches arising from these cords what we see now. So we have branches arising from these cords such as lateral cord, posterior cord and medial cord. From lateral cord we will get 3 branches. and then we'll be having posterior cord and medial cord. It is giving 5 branches each. So altogether from brachial plexus we are getting 13 branches. This is a very simple way for knowing brachial plexus in easier diagram, and it is very useful for you to draw in your exam also. Now we are going to see about the branches from the root of brachial plexus. So branches will arise from root, trunk, then after it is going to arise from cords. Now we will move on to branches from the root of brachial plexus. So from the root we have dorsal scapular nerve. In this image it is clear that dorsal scapular nerve, it is arising from C5 nerve, spinal nerve. So this is the C5 spinal root. So from here we will be having one nerve arising, that is dorsal scapular nerve. Then we have another nerve called phrenic nerve, a branch given to phrenic nerve, that we will call as, and also it is also taking from C5 nerve. And then we have long thoracic nerve or nerve of bell, which is going to supply serratus anterior, and it is going to take fibers from C5, C6 and C7. You can make out that clearly. A vertical course, you can see that vertical nerve is nothing but long thoracic nerve or nerve to serratus anterior. Now we will have another nerve called branches to muscles. So muscular branches also will be seen coming from roots of brachial plexus. Those are branch to longus colli and scalenii muscles. That's all about the branches coming from root of brachial plexus. Now we will move on to branches from the trunk of brachial plexus. Here, so these are the trunks, superior, middle and inferior trunk. Now we have branch called nerve to subclavius. So that is coming from upper trunk from the lower border, and it is going to carry fibers of C5 alone. And then we will be having another branch called suprascapular nerve, that is also arising from upper trunk, and it is going to supply two muscles such as supraspinatus muscle and infraspinatus muscle. Now we will be discussing about the clinical aspects of brachial plexus. I think it is clear to you about the trunk of branches from the trunk and root of brachial plexus. Now related to that we will be having a clinical aspect called Erb's point. So Erb's point is nothing but a point in upper trunk where 6 nerves meet. You can make out a point here where we have 2 roots meeting up to form the upper trunk, and we have anterior and posterior division. Later from the trunk we have 2 branches, that is above one branch and below one branch, and that branch is suprascapular and subclavius nerve. Now it is arising from, it will be having 6 nerves, right? Those are, first one is C5 root and second one is C6 root. Then we have suprascapular nerve and nerve to subclavius along with anterior and posterior division of upper trunk. So these are the 6 nerves going to meet in a point, and that point we will call as Erb's point. The clinical aspect of this Erb's point is it will lead to Erb's paralysis, which we will deal later. Before moving on to those things, we will see branches from the cords. So we have 3 cords, right? That is from lateral cord, medial cord and posterior cord. Now we are going to deal with branches coming from lateral cord. So lateral cord you can make out in this picture. This is the lateral cord formed by anterior division of upper trunk and anterior division of middle trunk. So these branches are lateral pectoral nerve, musculocutaneous nerve, and then lateral root of median. Now you can remember this by remembering a mnemonic called LML. So LML means L for lateral pectoral, M for musculocutaneous and L for lateral root of median nerve. Lateral pectoral nerve carrying fibers such as C5, C6 and C7. Same in the case of other 2 nerve also. Those also going to carry C5, C6 and C7 nerve fibers along its course. So these are the 3 branches of lateral cord having. And about these branches we will deal later along with its supply into muscles. So if you are dealing with muscles and their particular region, that time we will deal with these nerves, how it is going to supply the particular muscle and the particular area. Now we will just see the names of the branches coming from brachial plexus. Now we will move on to medial cord branches. So medial cord you remember with the mnemonic 4M and 1U. So 4M and 1U altogether will be having 5 branches coming from medial cord. One is medial pectoral nerve carrying C8 and T1 fibers. Then we will be having medial cutaneous nerve of forearm and that is carrying C8 and T1 fibers. Then medial cutaneous nerve of arm that again carrying C8 and T1 fibers. Then we have ulnar nerve which will have C8 and T1 fibers, and then medial root of median nerve that again going to carry C8 and T1. Here you can make out we will be having 4M and 1U. That is all the mnemonic about branches of medial cord. Medial pectoral, medial cutaneous nerve of forearm, medial cutaneous nerve of arm, and then we will be having medial root of median nerve along with U for ulnar nerve. All these are going to carry C8 and T1 nerve fibers. Now we will move on to posterior cord branches. So make out the picture clearly, so then it will be easier for you to understand. So when coming for posterior cord, as I already said, again it is going to give 5 branches. Here you remember like ultra. So ULTRA, that is a mnemonic for posterior cord branches. So if you remember these mnemonics, it will be better and easier for you to remember the branches names. Now we will move on to branches of these. First one, ultra. U for upper subscapular nerve, and that is carrying C5 and C6 nerve fibers, and then L for lower subscapular nerve, that is again carrying C5 and C6. Then we have thoracodorsal nerve, which is otherwise known as nerve to latissimus dorsi, which is going to carry C6, C7 and C8 nerve fibers. Now we have another nerve called radial nerve, and that is going to carry all the nerve fibers C5, C6, C7, C8 and T1, and it is a continuation of posterior cord, which is the largest branch of brachial plexus. So radial nerve itself is called as the largest branch because it is going to continue as posterior cord. Then we have axillary nerve, that is going to carry C5 and C6 nerve fibers. So we have a mnemonic for this as ultra. For lateral cord we have LML, for medial cord we have 4 M's and 1 U, and that's all about the branches of posterior cord also. I think it is clear for you. You keep on reading all these branches name, then it will be much easier for you to remember. Now we will go on to clinical aspect. So first condition is winging of scapula. You might have already learned in a pectoral region about serratus anterior we dealt, and the clinical aspect of serratus anterior is also the same, that is winging of scapula. So here involvement of nerve to serratus anterior will happen, as you know, and then we have excessive prominence of medial border of scapula. So this is a condition causing the winging of scapula, and then we will be having loss of punching and pushing actions made by scapula in this condition. And that's all about the clinical aspect of winging of scapula. Think you will remember this. And now we will move on to another clinical aspect, that is Erb's paralysis. You already know where is Erb's point present, where 6 nerves meet. Now injury to upper trunk of brachial plexus will lead to this paralysis called Erb's paralysis. What are the conditions we can make out here? Those are arm is adducted. You can make out here arm will be adducted close to our trunk, and then we will be having extended elbow. You can make out in this picture. Then we will be having pronated forearm. Forearm will be turned off. So pronation will happen for forearm, and then it is also medially rotated. So these are the condition will happen for Erb's paralyzed person where injury to upper trunk will happen. This condition is otherwise known as policeman's tip. So policeman's tip condition is nothing but Erb's paralysis, and this will happen during fall from a building, and then during delivery also, if it is stretched in the neck region while taking due to traction, this will lead to Erb's paralysis. Now we will see about Klumpke's paralysis. Klumpke's paralysis, it is a condition involving lower trunk of the brachial plexus, and here we will be having effect in intrinsic muscles, and then also it will lead claw hand deformity and sensory loss along the medial border of forearm and also in hand. These are the condition happening for Klumpke's paralysis as you can see in this image, and it is mainly by sympathetic fibers pass through T1. So because sympathetic fibers are passing through T1, this condition is leading to all these above mentioned conditions because of the sympathetic fibers which is passing through T1 which is a part of lower trunk, and this is going to be called as and having a condition called Horner's syndrome. So Klumpke's paralysis will be giving a major condition called Horner's syndrome. Now this is mainly due to stretching of the or abducting more of the arm and forearm, and near to the axilla region. If it is abducted more, that will cause lower brachial plexus injury, and also obstetrical brachial plexus injury also will happen if hand or arm is stretched outwards first. Now we will see another condition called thoracic outlet syndrome. In this condition, what will happen is a cervical rib or else a fibrous band from the cervical rib will press upon the lower trunk of brachial plexus. So in last what will happen, it will again compress the subclavian artery because of the narrowing of cervicoaxillary canal. Because of the presence of cervical rib or else fibrous band if present, this will lead to narrowing of the apex of axilla, that is cervicoaxillary canal. This will lead to compressing of the brachial plexus lower trunk to the subclavian artery. Later, this will again lead to paresthesia along the medial border of arm and also some wasting of small muscles of the hand, because this is the nerve which is going to carry C8 and T1 nerve fiber. So thoracic outlet syndrome is also equally important in brachial plexus topic. So that's all about brachial plexus you have to know. And another more condition, if you want, you can remember, that is crutch paralysis, and this paralysis is happen due to the crutch usage more. So constant pressure from crutch will cause radial nerve to compress. So after radial nerve is involved in this, what will happen? Obviously we'll be having wrist drop, because radial nerve is the nerve which is going to supply posterior compartment of arm, forearm and hand region, that we will study later. So crutch paralysis also is included in this brachial plexus clinical aspect. So all the clinical aspect you have to remember: Erb's paralysis, Klumpke's paralysis and cervical thoracic inlet syndrome, and then we will be having crutch paralysis caused by radial nerve compression. So that's all about brachial plexus, a very important and easier topic to remember. Thank you for hearing.